Hi, I'm Becca Kennedy.
And I'm Howard Schubiner.
And this is The Science Behind the Symptoms,
where together we will explore the new science of neuroplasticity through a lens of curiosity.
This is a podcast for the Association for the Treatment of Neuroplastic Symptoms.
I'm an internal medicine physician and a clinical professor at Michigan State University College of Human Medicine. I work at Cormendi Health. I've been doing this particular kind of mind-body work or neuroplasticity work for about 23 years now.
I'm a family medicine physician. I worked at a migrant farm worker clinic and then at Kaiser Permanente for 15 years. And I was the lead of the long COVID clinic. And I now have my own practice where all I do is focus on these sort of neuroplastic symptoms.
So we're both physicians who are working a little bit outside the system, would you say, Becca?
Definitely outside the system. Just definitely going down our own path.
Right, because we've discovered something that we're so excited about that we're going to be talking about in this podcast and a whole series of podcasts about new and groundbreaking research and science to help people who've been suffering with chronic neuroplastic symptoms for a long, long time.
Wait, Howard, I'm gonna have you say that again, because this is new and groundbreaking. I mean, this is amazing what we're going to talk about. This science will knock your socks off. Definitely knock my socks off.
I love your energy, Becca. Well, what is the ATNS, the Association for the Treatment of Neuroplastic Symptoms?
So this is a nonprofit where all of us have this enthusiasm for this new science. And the point of it is to spread the word, is to get the message out that there is new science to help people with chronic symptoms recover.
And how many people are we talking about in the U.S. or worldwide, would you say, Becca?
There's an estimate that 1.5 billion people suffer from chronic pain.
Wow. We're talking about billions of people, and this is people suffering with back pain and headaches and joint pains and stomach pains and all over pains.
Yeah, all over pains, as well as lots of other symptoms, fatigue, dizziness, irritable bowel syndrome. But we'll get to those other symptoms in other episodes.
And what are we saying that's different and unique that people aren't aware of?
When I grew up in my life and in my doctor life, my understanding was that all pain was generated because of tissue injury in the body, that you had to look in the body to find the injury that generated the pain.
Well, that makes sense, doesn't it? I mean, everybody knows that.
It is true. That's what everybody thinks. But Howard, what do we know now? What's the new science?
Well, it's just as shocking as how many billions of people are suffering and really suffering with chronic and horrible situations for which there's been little hope. It's just as shocking that there actually is hope, that neither of us were taught in medical school or in our residency programs, that we had to learn all on our own. And it comes from the new science of the brain, how the brain works. And the fact, and this is bizarre, but the fact that pain is generated in the brain. It can be due to tissue injury in the body, obviously. If you have a broken leg, you're going to have pain. But a lot of people, it turns out, and we have research studies to show this, a lot of people have pain, such as back pain, that's not generated in the back, that is actually generated in the brain, which makes it...
Wait, Howard, I want to clarify because, so are you saying that the pain is just in people's head?
No, all pain is real. Like I said, people are suffering, and neural circuits in the brain are actually causing pain, even when there's a physical injury. When there's a physical injury, you touch a hot stove, signals go to the brain. But
the brain is in our head.
It is, exactly. And the brain then decides, this is so weird, Becca, the brain decides whether to turn on pain when there's an injury. Most of the time it does, because we need pain.
So the signal of pain is made by the brain rather than by the nerves out in the body.
Exactly. The nerves send signals to the brain, and the brain usually will turn on pain. If you break an ankle, you want pain. Pain is a protector. It'll help you to stop, to be alerted to it, etc. But it turns out that the signals that go to the brain are not pain signals from your leg or your arm. They're danger signals. And the brain has a danger sensing mechanism, a threat sensing mechanism that is always going on in our subconscious brain that's making decisions moment by moment whether there's an actual injury or not and whether to turn on pain or not.
So if there's an injury, then the nerve sends a danger signal to the brain and says, hey, injury. And then what happens? And then how is pain made?
Right. So the brain has the power to create what we experience. And we're going to talk a lot more about this in upcoming podcasts. But in terms of pain, the brain can light up pain in the absence of injury. Think about a phantom limb syndrome situation. You've seen people with it.
Yeah, absolutely. Right. So someone doesn't even have part of their body, like they're missing a foot or a leg, but they're experiencing pain in their leg, even though they don't even have that body part.
Actually, and it's shocking. It's so weird. It's like, how could you feel the leg that's not there? It's because our brain creates what we feel. And this is not a woo-woo. It's not a new age concept. It's hard neuroscience. And everybody knows if you have a stressful day at work, you may get a headache. That doesn't mean there's injury to your brain.
Yeah.
What's happening there? If you have to give a lecture in front of 100 people and your stomach turns into knot, it's happened to me many times.
Right.
I remember I was giving a lecture, getting ready to give a lecture to a bunch of people, and I felt cool as a cucumber. And I love talking, as you know. But I looked at my hand, and my hand was shaking. My hand was literally shaking in fear, and I didn't even feel it. But my brain was creating this kind of danger signal, alerting me, like, "Hey, this is kind of stressful." And that was really shocking.
Yeah. Right. Because the pain is a warning signal. It's a warning signal of danger rather than pain being a signal of tissue injury.
Right. And when you have a warning signal, when you have pain or other symptoms that are not due to tissue injury, you need to know that, because if you're treating, and we'll talk more about this, but if you're treating a symptom as being due to damage in the body, you're going to try to fix the body. We're going to try to do things. You're going to have, you're going to have medications, you're going to have physical therapy, you're going to have injections, maybe even surgery, where you've seen this all the time to fix things that may not be broken. And this is the paradigm shift that we're talking about here. This is a huge shift in understanding that some people have pain and other symptoms that are neuroplastic. They're not due to injury in the body. And those are potentially reversible. That's what we're doing here.
So are you saying then if someone has a broken foot or an infection, that the pain that they're having from that problem, you could turn off, that you can just get rid of that?
Yeah. If you were a Buddhist Dalai Lama, maybe, but mostly no.
Right.
Mostly you can.
So all pain is made in the brain, but it's about making the diagnosis of what treatment do you need to help that person with. So if there's structural damage in the body, then we treat in one way, give an antibiotic or a cast or whatever it is to treat structural damage in the body versus the pain signal being made by the brain that's stuck in place.
Exactly. And we have research studies to show that chronic musculoskeletal pain, chronic back pain. We have studies in long COVID showing that these symptoms can be reversed, not just reversed a little bit, not just coped with, which is so often the case where people have chronic symptoms are told that they just have to live with it and cope with it and suffer with it. Mm-hmm. But that these symptoms can actually be reversed. And we've got data to show that. We'll share that all with you.
And that this data is amazing. The science, again, is awesome. So let's just give us a little teaser. Talk a little bit about a couple of the studies because they're amazing.
Right, exactly. So the Boulder back pain study, we randomized people, to our treatment versus a placebo injection versus treatment as usual. And in our arm of the study, and I was involved in this study, and I evaluated all the people in the study who had back pain for an average duration of 10 years. And when I evaluated them, and we're going to talk about how we do this evaluation, when I evaluated them, 95% of them had pain, which was purely neuroplastic. Amazing. And 75% of those that we treated were pain-free in 1 month.
Wow. Pain-free.
There's never been a research study on chronic back pain that showed, right? And that was at University of Colorado. And at Harvard, Mike Danino, our colleague, and I helped him with this study as well. He did a similar intervention with people with chronic low back pain. At 2.5 months, 2/3 of the people were pain-free. So
Amazing.
we're seeing amazing results.
Amazing. And we're going to dive into this in this podcast. We're going to explore how people got better, what the tools are. But again, give a little teaser, because I'm sure our listeners want to know, is this a new medicine? Is it a supplement? Is it a procedure?
Yeah, exactly. It is shocking. When I started doing this work 22 years ago, I was thinking, like, how could I help people, who have headache I saw a lady with headache for 17 years, chronic severe headache every day. And what could I do that would be different? Because she had seen specialists and some of the best headache doctors in the country.
Yeah, I imagine.
And what could I do, right? Well, it turned out I can listen. Number one, I could hear the story and look for situations that might have triggered it and might have brought it on. And I could help understand the process that she was going through and help her understand that her pain was real. It wasn't imaginary. It wasn't all in her head. It wasn't because she was crazy. It wasn't because she wanted it. It's not her fault, right? We can understand. She could understand. Obviously, everybody knows that.
Right. But so they're concrete tools that doesn't involve external things, no medicines, supplements, procedures, but actually counterintuitive tools, I find, that you teach the person, right? That you teach her how to do herself in order to rewire that neural circuit.
Exactly. And it sounds too good to be true. And it sounds
absolutely.
Wait a minute.
Right there with you.
How's this happening? After all these years, nobody else could help me. And you explain it to me in a different way. You begin to understand how the brain works. We're going to talk about that. How does the brain work? And how can I change the neural circuits by the messaging that I give to myself? How I respond to the sensations, how I treat them, how I treat myself, what message is it for my life? We're going to talk about all that stuff.
Because the pain is a neural circuit that's made by the brain, that's learned and practiced and stuck in place. And just like our brain and neural circuits learn all of these other things, how to talk and walk and think, and it's automatic, we can rewire through practice and tools and get into that brain.
Exactly. Because the brain works by something called predictive processing. This is the neuroscience of how the brain works. And this neuroscience was not taught to me in medical school. And I'm pretty sure it was not taught to you, even though you went to medical school, only 20 years ago, whatever, 50 years ago, I don't know, right? But it wasn't taught. It wasn't taught in our residencies, and doctors don't know this, and physical therapists don't know it, and chiropractors don't know it, and alternative medicine doctors don't know it. Our brain literally creates what we experience. How do we see?
Yeah.
My God. Well, it sounds simple. Light comes in your eyes and you see what's out there. But that's not how it works. Light comes in your eyes, but that light gets transformed into neural circuits, into electrical impulses that go to the part of the brain that creates our vision.
But it still is creating it from the light that comes in, right? Our brain makes it, but it's using what our brain predicted.
Exactly.
So what our brain has learned through our life, our brain then predicts what's happening, and that's largely what actually creates our experience.
Exactly. It would. Why would 90% of the fibers that go to the visual cortex, the part of the brain that creates the images that we see, why would most of the fibers coming to it come not from our eyes, but come from within the brain?
Oh, yeah. I'm sure our viewers actually don't know this.
No,
Say this again. So the fibers between our eyes and our brain, you would think the fibers go sort of in one direction from the eye to the brain.
Exactly.
But say that again. How much of the fibers go the other direction?
Right. Our brains are really big and they take up a lot of energy. And we have survived on this planet because our brains can predict danger and keep us out of danger. And if you're, on the savannah and you're looking around, your brain is trying to predict what could be dangerous. Is there a lion or a tiger out there? What are those clues? And the brain is remembering all the different times that it saw dangerous situations. When you're driving on the highway, your brain is constantly looking out for danger. And it's remembering all the times when a car swerved toward you or a person was weaving in their lane and it turned on a danger signal. So we see quickly. Our brain has to work so quickly, faster than it can actually process information coming from the outside. So it needs information coming from within the brain and our memories. And this is weird to think about, but we know for a fact that people who have witnessed crimes, they saw a criminal, and then they go to the police station and they say, okay, who was it? Was it this person or that person? And they say, oh, it's definitely that person. And then they're wrong most of the time. Why?
Yeah.
Is it? Right.
Right. So again, the fibers between the eye and the brain, the majority of the fibers come from the brain to the eye.
Exactly.
Right? That's what they found was neuroscience.
Right. And from the brain to the visual cortex so that it helps create the images that we see.
Yeah.
And so we're going to get into a lot more of this, as we go through this podcast. But our brain creates what we see. Our brain creates what we hear. How many times have you heard something, heard your name called, or heard something that's not there? Have you ever listened to a song and got the lyrics wrong? I mean, come on, right?
Yeah.
That's
exactly.
That happens all the time. And it's also what we feel. Have you ever had the experience where you felt a cell phone vibrating in your pocket when it wasn't?
Yes, all the time. And I thought it was a little crazy. I was like, oh, it's in my pocket. And I reach in and it's not even there.
Exactly. And it seems like you're hallucinating or whatever, but it's just the fact that the brain has the power to create what we experience.
Yeah.
And when you apply that clinically to people who have pain and fatigue and anxiety, depression and other symptoms, when you apply that clinically, you have the opportunity to intervene. And this is the revolution, that we're talking about.
Yeah. And it's amazing. I want to actually just take a moment because this is amazing. I mean, it is hard to wrap your brain around, is that the signals of what we're experiencing in our body, not only in terms of sensations, but also even function, is happening because of what our brain is telling our body what to do. And those signals are neural circuits that get stuck in place, and we can teach someone to change those neural circuits and turn off the signal completely. So someone with chronic pain or other chronic symptoms can often resolve their health wholly and completely and turn off the symptoms entirely. And that's revolutionary. I mean, that is hard to wrap your brain around.
Are you excited about this?
I am very excited because it's really
right. And it's not just a theory. I mean, it's the fact. It's the reality. That's how the brain works. We weren't taught that, but now we know it and you can apply it. And when you see somebody, and in your practice and my practice and all of our colleagues' practice, when you see somebody who learns a different way of understanding what's going on, they may have thought that they had a car accident, they did have a car accident 10 or 15 years ago, and they thought that accident was the cause of their ongoing neck or back pain. But it turns out that the injuries that they had have healed because all injuries heal, and that the source of this ongoing pain is a learned neural circuit in their brain that's real, not imaginary. It's not in their head. They're not crazy. Mm-hmm. It's not their fault. They don't want the pain, but it's there and it's real. And when it's caused by neural circuits in the brain, as you said, and it's reversible and their pain completely goes away and nobody else could help them for 10 or 15 years, that's frigging amazing, right? It's incredible.
And it's remarkable, right? And patients are told lots and lots and lots of different things of reasons why they're having the symptoms.
Yeah, exactly. I mean, you go to different doctors and you get different diagnoses. So some doctors, and they'll say, and we're going to get into this more as well, but, they'll say, well, your MRI is abnormal. So that must be the source of the pain. And then, but they don't tell you, guess what? All MRIs are normal in people who have a back. I mean, and we did a study and we'll review this. We did a research study where we took 222 people with chronic neck and back pain. And we evaluated them using our model of evaluation, which we're going to get into. And 98% of them had abnormal MRIs of their neck and back. But when we use the model that we understand to really drill down and listen and take the time to carefully evaluate, is their pain actually structural or not? Or is it neuroplastic? 88% of them we determined with accuracy were neuroplastic. And that's revolutionary. Most doctors was telling you it's with your back.
And that also dovetails on another study that actually you weren't a part of. Your studies are amazing, but we're not just going to talk about your studies in this podcast, Howard. But the study where they looked at 3,000 people with zero back pain and did MRIs of all of their backs, and they found that a progressive percent of people had abnormal findings as they got older, and 20% or so of people in their 30s or something like that had degenerative changes, and it progressively increased until 96% of them, or almost 100%, had degenerative changes by the time they got into their 80s.
Exactly. Bulging discs, degenerative discs, arthritis. And these are people with no pain.
Right. Zero pain. But yet they had these findings on their back. And as a family medicine doctor, not understanding this information, I often would tell people that the reason that they had their pain is because of these findings on their studies, but those findings were incidental and they weren't actually the cause of the symptoms.
Imagine going to a doctor. Sorry to interrupt.
No, that's okay. You got important things to say.
We'll go back and forth. Imagine going to the doctor with pain in your scalp, and the doctor looks at you and says, I see your hair's getting gray. That's the cause of the pain. It's like, I mean, nobody would, it's just insane, right? You've got facial pain. Oh, it's your wrinkles. You're getting older. It's like these changes in the MRIs and people are back are graying of the spine. They're normal changes that occur with age. They're not the cause of pain. And we know that now. And so it's just shocking how.
Right. And this happens all the time because clinicians, doctors, ETs, naturopaths, chiropractors, whoever it is we're all trying to find a reason for someone's suffering and their pain so we can help them. And if people don't understand that the symptoms are made by the brain as a signal of danger, and we think that it's happening because of tissue injury out in the body, then we say lots of different things in order to describe the reason for the symptoms. But a lot of those things aren't the actual reason for the symptoms.
Right. And we know that because of very simple things that happen all the time. We know, for example, that people can have an injury and have no pain. How do we know that?
Yep.
Well, a friend of mine was at a construction site, shot a nail in his hand by mistake. He looks down at it. He's bleeding. There's a nail in his frigging thumb, but he had no pain. How can that happen? Because the body sends signals to the brain. Normally, usually 99% of the time, those signals will cause the brain to turn on pain, but sometimes it doesn't. And everybody can relate to that in some way. People have had those experiences, so they know. Yeah. So we know because of that simple fact that not all injuries cause pain. We know that the brain is the decision maker, the arbiter of whether pain occurs or not. And we need pain. Pain is a danger signal, a warning. If you break an ankle, you want pain.
Right. I mean, people can go on stage and have stage fright, and they can get a headache and a stomach ache and tingling and dizziness and numbness. All those symptoms are real. They're not making up the symptoms. They're experiencing in their body these biochemical changes even, but you wouldn't send that person to a neurologist for their headache or their dizziness, or to a cardiologist for their heart racing, because we understand it. We know that it is because of the brain perceiving threat and then sending warning signals to the body.
Yeah, I mean, the brain has it's like a smoke alarm, really, right? When you have smoke, the alarm is supposed to go off. It usually gets it right, but sometimes the smoke alarm is set a little too sensitive. And in fact, steam can cause the smoke alarm to go off. It's not smoke. But it's particulate matter, it's steam. So it's basically a false alarm.
Yeah.
And, so we know that happens as well. We talked about phantom limb syndrome, but, the story we love to tell is about the guy who was in Britain who jumped off a scaffolding at a construction site. This huge nail went all the way through his sole, through the top of his boot. He screamed in pain. They rushed him to the hospital. And what happened?
They get him to the hospital. They had to give him huge amounts of painkillers because he was experiencing so much pain. They took the boot off, and then they found that the nail hadn't even caused a scratch.
Exactly. Would you like to be a fly on the wall there? It's like, oops.
Exactly.
Excuse me. Sorry.
I know. It just went through the toes, between the toes, and didn't even injure him at all. but yet he experienced significant pain, huge amounts of pain.
Yeah, real pain, not imaginary, because the neural circuits in the brain have the power to turn on real pain in situations when there's threat, when there's danger, when the brain perceives that danger. And the brain's doing its best, the best it can to protect us. It saw the nail. It knew that nails cause pain, had memory of pain. The guy's probably had nails stuck in him before because he's a construction worker. And it turned on this very real pain that was basically kind of a false alarm, right?
Yeah. So all of these all the pieces of information come to the brain, what the eyes are looking at, and also the signal from the foot up to the brain, but the brain has a bias for danger. And so the interpretation of the information, danger overrode the safety. So the information from the toe, where the toe said, I'm okay down here, no problem. But it was such a huge signal coming from the eye that the brain said, whoa, I got to protect myself, and sent the signal down.
Yeah. And like you said, the brain has a bias toward protecting us. Yeah. If you have to choose, like, and it's a millisecond, the brain has a millisecond to decide what's going on there, and it makes a decision. And the decision's often right, but the decision, as we've talked about, can be wrong in the sense of what people see, what people hear, and what people feel. Our job is to sort that out for people. You don't want to make the wrong assumption. You don't want to assume that just because you have pain, there must be damage in the body. And you don't want to assume the opposite. Our job is to find people who have infections, tumors, fractures, diseases, and make sure that those get appropriately treated by medical therapy.
Exactly, because as a physician, our job is to make the right diagnosis. And that diagnosis can often be lots of different structural things in the body. And we need to know the appropriate treatment so that the person can heal and they can get better. And in the same way, now we have this new science to understand the diagnosis of a lot of chronic symptoms is happening because of neural circuits in the brain rather than structural damage in the body.
Exactly. So it's super exciting. We're thrilled to be here to do this work. And it's kind of counterintuitive, isn't it? It's kind of counterintuitive. Like, wait a minute.
The understatement of the year, Howard, is completely counterintuitive.
You know what?
Every single part of it.
Do you know what WTF stands for, Becca?
I think so, but I think this is a family show, but I'll trust you.
The point is that that's how people often respond. When you begin to say, oh, it's in the brain. What does that even mean? How does that make sense? That's something we've never, if doctors don't know it, how are regular people going to know it and understand it? They're not.
Right, exactly. I mean, I have to admit, so I came to this as a doctor searching for this because it didn't make sense to me why so many people that I was seeing in primary care, we couldn't understand why they were having the symptoms and we couldn't help them. And then after I learned about this, I developed my own chronic pain and fatigue because our brains are just that hilarious.
Oh, man. And did you know, what were you thinking when you started getting, and I've had, I could talk about me all day, but I've had certainly pain and other conditions over the years that were neuroplastic in nature that I thought were structural.
Yeah.
They were real. How did you react when you got those?
WTF? No,
It's a family show.
Because I had already learned about this, I knew that it was neuroplastic, but even that, and though I was helping people, I was seeing people get better. This model made sense to me. In the moment, it was hard to believe 100% that there wasn't something going on in my body generating it. I mean, it's really hard to wrap your brain around. For sure.
Right, because the alarm mechanism, pain is such a strong message, such a strong alarm. It's doing its job. A smoke alarm has to be loud in order to be heard, in order to get your attention.
Yeah.
When the brain wants to get your attention from something, whatever's triggering it, to feel in danger, to feel in threat. We'll talk more about that as we go through this podcast. Whatever's going on there, the message needs to be loud. And and pain is a fantastic message. But you mentioned fatigue. I mean, there's a lot of other symptoms that people can get on a neuroplastic basis, right?
Yep, absolutely. Actually, any symptom in the body is generated by the brain, can be generated by the brain. So neuroplastic symptoms can be all over the body, any organ, any system, any place. It can cause functional changes even. And again, we're gonna dive all into that. In this podcast, we are going to take real live people and patients and their experiences, and then really dive into their symptoms and what makes sense in terms of what they've been told and the diagnoses and how that makes sense. And we're going to look at it through the lens of just being curious and science. And how does the science align with what people are actually experiencing in their body?
Exactly. We're sticking to the science. We're keeping an open mind. And the whole point of this podcast is to help people have an open mind. Yeah. And discover and look at what we're talking about. See if it makes sense. See if it applies to you. Maybe it does. Maybe it doesn't. But everybody has to make that decision. But what we're helping people, give them the opportunity to explore it and to see if it makes sense or not. And when it does, results are, astounding. How many people have you seen that have completely reversed pain or fatigue or other chronic symptoms? It's amazing.
Well, I've seen hundreds, and myself included. But Howard, how many people have you helped that have been told by lots and lots and lots of other practitioners and specialists that there was something going on in their body, but you helped them resolve their symptoms?
Yeah, I know. And I'm not saying it's me that I'm so great. It's just the model. This model really works. If it's 100 or 150 people per year and it's 22, 23 years, that's a lot of people. And it's
thousands.
We're not the only ones. There's dozens of other clinicians.
I would say hundreds of other clinicians throughout the world that have been doing this for a couple of decades even.
Absolutely. Absolutely. So we're not alone, but we're a small minority. And most people will not have heard of this. They'll feel it's counterintuitive. They often have a reaction like, are you saying it's all in my head, that it's not real? Mm-hmm. Saying that. So you understand the suffering.
Exactly. Right. And Howard, that comes up all the time. So why, if this has been around for so long and it's true, why have people not heard of it? And why did the absolute specialists at the top universities, why are they not the ones saying this?
Yeah, it seems shocking. When I started doing this work 20 some years ago and I started seeing these results, I started giving lectures because I do a lot of lecturing. I was lecturing to other doctors and other professionals, and they would shake their head and they'd say, yeah, that's really interesting. That makes sense. And then nothing would change. They wouldn't change what they did or how they approached things. And I was like, what the heck? How's that? Why aren't they like so excited about it? Because they, like we are,
I on the top of a mountaintop. Yell it out.
And it's because they weren't taught it and they don't understand it in that way. They haven't seen it in their own lives, or they haven't seen it in their patients, and it's just not part of their repertoire, not what they know how to do. And people just kind of fall back. And then maybe they try to explain it to some people, and then the people that they explain it to get offended, and then they don't want to do that. Mm-hmm. And it's been a kind of an uphill struggle, really, because it's kind of...
Yeah. I think also it's such a big shift in thinking. It's just, our human brain actually, because of the predictive nature of it, we put things into its box. And so I think when you hear new information, our brain kind of puts that into what it already knows, instead of really understanding that this is a huge shift. And things happen in medicine and in the medical field and scientific field just incrementally. Generally, there's just small little changes that's kind of a riff off of what's already there, kind of opening it up a little, like, oh, well, it's actually this medicine that helps, not that medicine, or, kind of these different things. My first day of medical school at the University of Michigan, our dean said to us, half of what we teach you is incorrect. We just don't know which half that is.
And in 10 years, right, and in 10 years from now, another half is going to be shown to be, wrong or needs revision, But if this was a pill, if what we're offering was a pill or a procedure, people would be flocking to it. It would have uptake immediately. But, we're dealing with the brain and we're dealing with things that are intuitive, and it's going to take time, but it's growing. And the this podcast is a little step in that direction. The Association for the Treatment of Neuroplastic Symptoms, our nonprofit organization that's sponsoring us, is a step in that direction. We're doing research every day. We've got a bunch of scientific studies we've already done and new ones coming down the pike. You know, I think it's pretty clear that what we're doing makes sense.
Well, I'm going to stop you for a moment there, Howard. It is very clear that this makes sense. And we're not saying that we have all the answers, and we're not saying that things aren't going to change and evolve. Absolutely. Hopefully they will. But where it is right now is that thousands and thousands of people have restored their health and restored their life from conditions that previously they were told and they believed were chronic, and there was no way that they could ever get rid of them. They were going to have them for the rest of their life.
And this is happening. We're going to make it happen. We're part of this movement. We're part of this paradigm shift that's happening. And we're here to explore it with you. We hope you guys continue to listen to us on future podcasts. We're excited about it. Becca's really excited, I could tell.
I'm very excited.
And,
Yeah.
then what we're going to do.
Absolutely. Definitely join us, show up for the next episodes. And we're going to dive down next time into how do you diagnose correctly? How do you diagnose that a symptom is happening because it's neuroplastic or because it's some sort of structural tissue in the body? So we'll explore that. We're going to explore more about the pieces of the science, some super cool things that will blow your mind. And then we're going to take stories from patients and really dive down again into what makes sense in terms of the science. So stay with us, and we're looking forward to it.
I'm Howard Schubiner.
And I'm Becca Kennedy. And this is the science behind the symptoms.
Thanks so much, guys. Take care.
See you next time.